guys ready?
We'll try it.
All right. Can you see it?
We are good to go.
Oh, okay. There. Can you see my outline?
Absolutely.
All right. Thank you for bearing with us. Sorry about that little bit of technical difficulty, but we're back. So today we're going to talk about the foot. Okay. And so the anatomy of the foot is very important when you talk about a horse's quality of care. And so talk about the structures. We'll also talk about the hoof wall and what it's made out of. And then we'll go into the balance of the hoof wall and then the terminology used to describe foot angles using x-rays. And that, I think that's a lot of our tailoring as veterinarians to help farriers as well as clients determine the well-balanced hoof. And then we'll go into the strength of the hoof wall. So with nutrition, the environment, these are all things that can factor into making some of these horses' hooves brittle, making them crack, all those things. And then all of a sudden their horse is lame. And so look at some foot diseases, all right, caused by improper balance, such as navicular disease / syndrome, and also caudal heel pain. And we'll dive into those terms in that section. And then injuries to the foot and the limb can actually, cause lameness, but we can alter the horse's foot to give them support, even with an upper limb injury. And so we'll talk about that as well. And so we can manipulate the horse's foot to create soundness in an upper part of the horse's leg. And then we'll do some review and then any questions at the end. And I put in here, no hoof care, no horse. And I truly believe that. And so we'll dive right into the horse's anatomy. I actually got this off, it's really a nice poster. And so this is just going through the foot. So looking up here along the long pastern. So first look up in the top of the diagram here. It's actually a cross section of a hoof. And so you can look at the long pastern, the deep digital flexor tendon, the short pastern bone. So the bony structures of the foot are in one single column. And so you have the coffin bone or the pedal bone, the navicular bone, the short pastern, and then the long pastern. And really the hoof capsule starts at the short pastern bone. And so really the coffin joint, the majority of it is actually attained in the hoof itself. And then you have the other terminologies or the other anatomy structures are the cornet band, the cornet band, the hoof wall, and the laminar region. The laminar region is whenever you have the non-stratified, sort of the dead horn or outer hoof wall, which is the diagram here, into the inner wall, which is interdigitated by the lamina. And so that's where you have the laminar region. That is actually made up of the white line. So when you look at a horse's hoof, the lower diagram, when you look at the bottom of the horse's hoof, you can see the white line, okay, in that diagram between the horn, which is the outer hoof wall, and the sole. And so that white line is actually shown into the interdigitation, if you look at it microscopically, of the lamina. And so that is a very common location for horses to get soreness and lameness and problems in that area, okay? And then the other area that you'd like to pay attention to in a balance of a horse's hoof would be the caudal heel, or the back part of their leg, of their foot. With the digital cushion, I think a lot of these horses that have negative palmar angles, and we'll go into that, but a lot of horses that have an imbalanced foot and they're landing more on their digital cushion have a lot more problems with their vasculature in their foot. So this digital cushion allows their blood supply to be pumped in and out along these vessels, arteries and veins and lymphatics, and bathe a healthier foot if they have an actual proper digital cushion. So that's always imperative to have a nice digital cushion or a caudal heel in a horse's hoof. This is just a gross picture of a horse's hoof. I think it's well balanced. You can look at the cornet band and the hoof wall. The other point I want to make out is in the lower diagram too. I know we're jumping, but look at the frog region. And this is an important area where you're going to see a lot of issues occur, a lot of diseases that can happen in the frog area, and you want a nice healthy frog. Thrush is a big deal this time of year with the wet weather. And so that is an issue when it comes to frog health and the health of the foot. The frog is definitely important in terms of, how the horse lands. And so when the horse lands and bears full weight, the frog actually expands. And when the frog expands and contracts, that's what pushes on the digital cushion, allowing the natural blood flow to go through their coffin bone, to go through their lamina, and to go through their joints. And so that's very imperative to have a well-balanced foot. So that's why I like these diagrams. So we'll go in then to the radiographic hoof angles. Okay, so grossly, now you know what the hoof looks like. Well, how do we look at it on x-rays, and what does that mean? So when you look at a horse in terms of, well-balanced angles and some musculoskeletal lameness associated with the hoof, first things you want to do is take x-rays. When you look at an x-ray of a horse, you can see on the screen the x-rays are of a left and a right front foot. And these feet, to me, when you look at these x-rays, you look at what's called the palmar angle. And so that's the number one, looking at the horse's overall balance from front to back, or dorsal palmar, okay, dorsal surface, palmar surface in the back. You look at the angle of the solar surface of the coffin bone in relation to the ground, okay? It's right there. So the angulation is imperative because then you have a well-balanced foot. For me, the angle, palmar angle, you'd want in a natural hoof is between 2 and 7 degrees, okay? I think in terms of, overall performance, I think around 3 degrees is where you want to shoot for. And so in this horse was well balanced in terms of its hoof care. And so you can see, with these x-rays, this is a proper degree of palmar angle that you would like to see in a horse's hoof. And so the palmar angle is one of those radiographic angles that you want to see and want to, inspect on any well-balanced hoof. The other area that you want to inspect, especially in the same x-ray in these horses' feet, I'm sure some of you are already asking, well, is the toe too long? Okay, when we have a longer toe or an elongated toe, you worry about breakover. And so the other angle is the breakover. And so we want to actually take a plumb ball. So you actually take a measurement 1 inch from the cornet band, go out dorsally, okay, in the front of their hoof wall, and drop a plumb ball, a straight line down. So the second nail hole in this horse's hoof on this x-ray is actually where the breakover should be. The definition of breakover is the last point of contact from the ground surface. And so when the horse were to bear weight and then push off, that actual horse's breakover is about 1 inch longer than it needs to be. And so what that does is create a lot of pressure in the back part of the horse's hoof, okay? Even though the palmar angle, which we already had discussed was normal, is good, okay? But then you have an elongated toe. And so the horse essentially is wearing clown shoes, okay? It's wearing flippers. And so when you try to bear weight and walk forward in flippers, you can't. It hurts the back part of your calves. And so when we wear flippers on our feet and big, long-toed shoes, we actually walk backwards because it's more comfortable. And so the same thing happens here. Their breakover is too long. So their elongated toe is making their caudal heel pain, or that area in the back hurt. And so this is an imbalanced foot. And so what would you do? You set the shoe back, okay? So you would actually go ahead and trim that toe a little bit back, and then also you'd able to use a multi-beveled shoe, which we'll get into, to allow their breakover to be at the second nail hole. Even though you can't take, let's say we can't take all of the toe at once, you can still go ahead and use a shoe to properly attain breakover, okay? All right. The next radiographic view or angle that you would try to determine is dorsal hoof wall angle. Okay, this is important, especially in this x-ray. You can see here, this horse has chronic laminitis. Okay, it's been managed, it has been managed, and is in the process of being managed. And so the dorsal hoof wall angle is the comparison angle between the angle of the dorsal hoof wall, which is here, okay, in the front, and to the ground surface, and then the angle of the coffin bone to the ground surface. And you take those two angles and you subtract them. So I have it. So the dorsal hoof wall angle is 45 degrees, okay, right here. The first one out in front with the toe. The coffin bone angle is 56 degrees. So you subtract your coffin bone angle from your dorsal hoof wall angle, and you get a degree of rotation, which is 11 degrees in this horse's hoof, okay? And so that is a very vital tool when you want to measure any dorsal hoof wall sort of rotation in these horses that either have chronic laminitis, that have evidence of laminitis, have evidence that you may have some disparity of their hoof wall with, unfortunately with chronic abscesses can make the lamina, which is the dorsal aspect of the horse's hoof, become very fibrotic, and then unfortunately it'll give way and these horses can rotate. And so this is important of knowing this angle, because you can track the angle of your horse's hoof when you start to de-rotate these horses and to manage these horses with chronic laminitis. Okay. So now those are the three main radiographic angles that you want to see and want to measure, especially in talking about the balance of the hoof. Okay, so we're now going to talk about hoof nutrition. So nutrition matters. Okay, it doesn't matter if you're talking about the horse's hoof, the GI tract, the muscle, you have it all in one package. And so if you talk about a horse, you always have to think about the hooves. Okay, no hoof, no horse. And I'm going to keep saying that. And so it's very important. However, when you go to all Tractor Supply, you go to veterinarians and you ask what's the proper hoof medication or hoof supplement, there are a multitude of hoof supplements. Okay, and I think number one, you should ask yourself, what are the three main features of my supplement that is going to make a healthier foot? Is it going to increase my horse's blood supply? Okay, is it going to give proper structure components such as amino acids? Okay, biotin, hair, is it going to make them have a stronger hoof wall and a less brittle hoof wall? And then also, is it bioavailable? Okay, most supplements that we have in horses for horses' feet are oral supplements, meaning they're given by mouth and they have to be ingested. And a lot of these substances, even though they, there's Farrier's formula, there's Healthy Hoof, there's Kimmy's Cocktail, there's Platinum Hoof Support. These are all oral-based supplements. So the horse has to ingest it, and then that actual drug and those supplements have to get to the hoof. And so is it quite bioavailable as other products? And so those are the things that you have to ask yourself. And Well, in some horses, sometimes it works and sometimes it doesn't. Why is that? The answer is the bioavailability, right? So it's just like in people, some supplements people can ingest and it works very well. And people feel great and they have, they have success taking that supplement, whereas other people didn't really work. And so I think a lot of it has to do with bioavailability. And so when you talk about the horse's hoof, I think, you can choose Farrier's formula, you can choose platinum hoof support, you can choose Kimmy's cocktail, you can choose, a biotin supplement. I think all of them are reasonable, but I think you have to also pick out the ones that either have been studied, researched, and there's a lot of research based to get you on the right path, especially platinum. Platinum is one of the research-based products out there. The other is thinking about your overall horse's nutrition, right? So making sure you have the well-balanced feeding supplements, feeding regimen. So alfalfa, timothy, some grass hays, some carbohydrates or some concentrates. If you like beet pulp, I think that's good in some horses. So I think overall, thinking about your horse's overall health will maintain their horse's hoof health. So I think that's a matter of fact as well. And so, my biggest thing is nutrition for the horse will help the hoof. And so that is a image on the right. You can see that horse is actually on platinum hoof support. You can see at that point that was very brittle. You can see along the nail holes, it's just very brittle and poor quality hoof. And that horse is actually started that product a month ago, and now it's actually starting to grow a better hoof wall. So the other factor we have to think about in Georgia, especially down south here, is wet weather, okay, or in the environment. Unfortunately, we can't get away from the rain, right? And so these horses are naturally in a wet environment outside. The only way to help them with their horse's hoof, to dry out their hoof, to give them a drier environment would be to stall rest, or, in that picture on the left, lower left, you can see the horse in the stall, dry, very nice and clean. Those are things that do affect the horse's hooves. And so I think maintaining the horse's hoof quality is also maintaining the area of which the horses live or their environment. Horses that are in a urine, based stall, or if they have a lot of, waste products or soiled stalls and they have to live in that, I think that does affect hoof care. And so those are the things that proper horse management, cleaning stalls, and I get it. I've been there. And what's that, Ashley?
Somewhere in the car.
You good?
Someone's.
You good? Okay, just keep going. Okay, so can you hear me?
Yes, we can hear you. We're good.
Okay, good deal. So sorry about that. So yes, so I think also the environment, right? So I put in here, you can get a lot of these horses that have chronic hoof, thrush and cellulitis can occur with just the environment. And so I think management of the horse's environment is very important. Okay.
Yeah, my farrier asked me to pull my horses or put them up in the morning so that they wouldn't be in the morning dew. And I looked at him like he had 10 heads.
Yep. No, that's exactly right. So, I feel for these farriers too. Like I've had some farriers tell me already, I've been here just for about 1.5 years here, and they'll actually nail a horse's hoof, and they'll put a nail into the shoe and water will come out the nail hole. That's how wet the horse's hoof is. And that's pretty amazing. And you don't think about that, but it's true. Some of these horses are like a sponge. And so that makes the horse's hoof soft. And so those are all things that can create lameness issues and problems. So, but yeah, so I think that's a big factor in a well-balanced foot and the hoof care, is the environment too. Okay. All right, so we're going to talk about hoof wall diseases. So we'll get into the hoof wall cracks and abscesses. So I think now we'll tailor our talk to some of the disease processes and how can we manipulate the foot, or how do we help these horses with their lamenesses to manipulate their hoof in certain ways. And I think we can. So we'll talk about the hoof wall itself. So it's important to maintain hoof care, which we already talked about, but this is an example of like the hoof cracks, right? So the simple cracks that, hoof wall cracks turn into white line disease, and then unfortunately turn into laminitis. Laminitis doesn't mean rotation, okay? Laminitis is just inflammation of the lamina. This horse right here has laminitis, okay? And you can see it has white line disease. And so when you investigate with a hoof crack, how would you manage that? And so I think I would float that area, okay, and put a shoe on the horse. And so the shoe would help support the horse's hoof and have a well-balanced foot, and also float that area where it's cracked to not allow for those shearing forces. So when you think of a cracked hoof, the first thing you have to think of is a ruminant. Think of a cow, okay, a cloved hoof. Every time the horse steps, those two edges of that crack are going to spread, and they'll spread a little more, and they'll spread a little more. So initial cracks, no big deal. You're like, oh, no worries, it's just a crack in hoof wall. Well, when the horse continues to perform for you and continues to go, all of a sudden, oh, my horse is, and you pull him out of the stall, my horse is, 3 out of 4 to 5 lame. It's like, oh no, what happened? And so these cracks that start out like this can actually snowball, and they can create laminitis and inflammation of that lamina and create lameness and unfortunately non-use. So you have a horse that you can't use. And so I think this is where good quality hoof care matters, and picking up on these little details. And so that actually, this horse has white line, has laminitis, and also you can see, look at the pasture and look how thick all the skin looks, and the dermatitis. This horse has cellulitis. It's not associated with a puncture in the back of the horse's leg. No, it's associated with the foot. The actual infection in the foot created the cellulitis. And so I think this is where you can have a horse's foot, just simple management. You can delay the process, and you can stop the laminitis from occurring, and you can also stop the cellulitis with just addressing that hoof crack is when it started. And so that is a big deal. Okay, and so this horse was managed. You can float that toe and float that area, that medial bar of that foot. Trim the horse, put the horse in a shoe, and then treat the cellulitis with some antibiotics and anti-inflammatories. And the horse did great. And so I think those are all things to think about. The other unfortunate thing is quarter cracks. Okay, happens in every discipline. Quarter cracks are real. They try to be patched, and so I think patching these quarter cracks is a good thing. However, if they still have infection in there, you can see on the left hand picture, this is a patch that was applied to a quarter crack. Unfortunately, the infection wasn't all out of the hoof, and you can see that there's black discharge coming from the area distal of that hoof crack, and so of the quarter crack. And so we went ahead and dremeled out that area, and you can see we laced it in the image on the right of your screen. So that is actually lacing of the quarter crack area, and we went ahead and debrided all of the poor hoof wall, and so all of that infection is cleared. It's able to drain, and then the reason for the lacing, I like to lace my quarter cracks. I think patches are good, but I think some of that can maintain contamination, which it already did on the first image there. I like lacing because it helps stabilize the coronary band. So when you have a horse that has a quarter crack, you don't want the crack to continue to progress proximally to that cornet band. If it hits the cornet band, then you have a lot of issues with lameness, and you have a lot of time for it to grow out. If you can stabilize a quarter crack just distal to that cornet band with lacing, you let that grow out, and it'll be a natural hoof wall going forward. And I think that's the benefit of lacing. Okay. And then the dreaded subsolar abscess. So subsolar abscesses do occur in a lot of these times of the year because of the wet weather. Okay, and so you can see the image there. We debrided. Unfortunately, with most subsolar abscesses, you have to debride to alleviate the pressure, right, and the drainage. Some of these horses do just fine without a medical plate, which you can see there in the image to the right. However, most of the time, depends on how bad the abscess is. And so most of the time we do have to make a defect in that hoof wall. And unfortunately, with this horse, some of that defect was not able to be managed just with a shoe. And so we placed a medical plate on that horse so it could be maintained and be ridden, and it was sound. And so that actual area where the abscess was alleviated was packed with antibiotics, iodine, and then the medical plate was placed on there, and you can see the image where the foot is. You can see the lateral image of the foot with the medical plate on. Looks like a normal foot, and those horses can go in deep sand and go into the arenas and perform even with a medical plate. So that maintains the horse's performance, and you can still manage a subsolar abscess and not have to lay the horse up for a long time until it heals. A long time in I think in some disciplines is maybe a week, but if you want to do it pretty fast and get back on the horse, I think medical plates are the way to go. And so medical plate's pretty nice. You can see there, there's bolts attached, but the medical plate is placed on the horse's shoe. We place some threads through the shoe, and then you can attach the plate with bolts at home, and you can manage this very easily at home. And it gets the sole off of moisture, it gets the sole off of the ground. Those horses are less likely to be contaminated, and the horse will heal up within about 2 weeks and be able to have its plate removed. And also the nice thing about the shoe is once you remove the plate, you can keep the shoe, and so the horse can go back to performance. So, and then unfortunately, we talked about this already on the first slide, tailoring into this, but this is a case of white line disease that created a subsolar abscess. So this was actually dry cow. So I like to use antibiotic paste. So either Today paste, dry cow paste for my white line disease horses, and also for thrush as well. I think the application and the applicator is soft enough, that you can actually put in the tip of it into a horse's frog, into the horse's, you can see here the nail holes, and actually put antibiotics right into the area that's infected. You can see the image on the left is the area that with the nail holes, we pulled the shoe here. There was drainage from the nail hole. And then the image on the right, you can see that there is a subsolar abscess that is actually draining after the nail holes were filled. You can see it draining from the actual solar margin. And so we went ahead and debrided that solar margin, put the horse into a medical plate, and the horse was back to riding in 2 days. And the horse healed up very nicely. But white line disease is unfortunate. So we'll move on to a well-balanced foot, looking at caudal heel pain. Okay, so the foot itself and the structures in the back part of the foot, there are a multitude of structures. So there are ligaments, tendons, suspensory ligaments of the navicular bone, so coffin bone, digital cushion. You have the deep digital flexor tendon is a major tendon. Okay, you can see in the image on the screen, you can look at the navicular bone. The navicular bone is outlined. Okay, it's in the shape of a boat. Okay, the Navy, the navicular bone. So think of the boat, the back part of that foot. This is a skyline view. So the horse, this is a back shot. So horse is extended out, and you're shooting straight down into the back part of their foot with the x-ray beam. when you look at this navicular bone, two things you want to look at: the lucency of the black in that bone, and also the irregularity of it. So when you look at the bone, it should have a nice, smooth outer bone, okay? This cortex should be very nice and smooth. It's not. Looks like something took a bite out of it, right? And so there's a little irregularity or osteosclerosis and osteomyelitis. So there is osteitis occurring in this navicular bone. And so this horse has navicular bone degeneration. This, unfortunately, is one piece of caudal heel pain, okay? You can have navicular bone diseases. You can have, unfortunately, you can have suspensory ligament of the navicular bone tears. So this navicular bone is suspended in the back part of their foot with ligaments, okay? And you can have a tear in that. You can have a tear in the deep, okay? You can have a digital cushion infection. You can have, you know, a lot of structures back here. And I think we have to think about that in terms of the balancing of the foot. So dorsal or front to back balance, and also side to side, or lateral to medial balance. And so when you have a well-balanced foot, the horse is still lame, then you think about things like this. And so when you have this problem or caudal heel pain, there are shoeing. Okay, this is where I think shoeing changes or corrective shoeing can dramatically improve the horse's comfort. Okay, even though that, yes, there is navicular bone degeneration, I think you can still manipulate the horse's hoof to stay sound enough or have some relief. Okay, and I think that's important, and that's a well-balanced foot. And so I think that's where, when you talk about imbalance, how did you get that far? How did the navicular bone degeneration occur? When you look at this slide, you can see a major difference. This is on the same horse, okay? Right front, left front. They're labeled R and L. This is a lateral shot, okay? Lateral to medial view. You have the coffin bone here. You have the navicular bone in the back part of the foot. You have the pastern bone, and then you have the long pastern bone, okay? The short pastern, long pastern, excuse me. So that is in that, so that's the first image that we've talked about, the anatomy. So when you look at this bony column and you look at the right front foot, that has pretty good sole depth, okay? And that has pretty good bony alignment, looks pretty good. When the horse bears weight on that right front, it's naturally going to bear evenly and well balanced. Look at the left front. So look at the left, same horse, same leg, or same horse, different leg. Look at the left front and where you're bearing your weight. This foot is imbalanced, okay? So you have a balanced right front, imbalanced left front. We'll go through the same thing. If you look down through the bony column, you can see almost like a bow, right? You're almost shooting a bow and arrow, and all of the pain, all of the pressure is coming and landing when this horse bears weight right on that navicular bone. So when you ask yourself, how did you get that navicular degeneration? The imbalanced foot, okay? That has a lot to do with it. So when you look at this left fore, you have a lot of imbalance front to back, or dorsal palmar, okay? And you can correct this with proper shoeing. Honestly, you can take a lot of toe here, okay? And this will already stand the horse up to a palmar angle of maybe 0, okay? So the horse is landing on that navicular bone. So when you talk about this horse and figuring out shoeing recommendations for that horse would be a natural balance or multi-beveled shoe. Now, you can create this. You have farriers that do a good job foraging. It depends on your relationship. And I think having a good relationship with your farrier, your veterinarian, and also with your horse is important, because ultimately, you know, when you see this x-ray from a veterinarian, you know that the farrier needs to then go ahead and shoe this horse correctively. And I think this horse would benefit from corrective shoes. Multi-beveled, multi-balanced. Bring that breakover back, okay? And also allow that horse to have a multi-beveled shoe. And so I would put this horse in a 2-degree multi-beveled PLR is one of the natural balance shoes. Farriers can create their own. They can actually go ahead and grind the surface of their shoe, their flat shoe, in an angle to allow, if you track this shoe looking at it front ways or long ways, excuse me, when you look at it long ways, you can see the multi-beveled all the way around, okay? And then you can see when you look at it flat, you can see that there is a 2-degree natural balance progression. And so I think that horse would very much benefit from that, let alone a veterinarian to perform intra-articular injections, okay? The key is when you see horses like this and you look at this imbalance, and this is another case, veterinarians can help, yes, but I think you need to biomechanically and fix the balance of the foot. Any veterinarian can do a great job injecting a joint, but you need the farrier's input and their expertise to make a well-balanced foot biomechanically. Because in this horse, same thing, left front, landing strictly on that navicular bone, right front looks pretty decent, okay? This horse is already in a 2-degree wedge. So you need to think about, okay, I can have a veterinarian treat this horse. How would you treat this horse? This horse most likely would be painful on the left fore, okay? So lameness, probably a grade 2 out of 5. Lame left front. You would block that horse, so nerve block that horse to a palmar digital nerve block, so the heel's down. How would you treat this horse? Well, 2 ways. First way, inject the coffins. Second way, inject the navicular bursa. I can inject both of those sites and you can go and perform with your horse in the same shoeing, and that horse will stay sound maybe 3 weeks, and all of a sudden will be lame again because you didn't correct the balance of the foot. This is the key to this lecture. You have to create a well-balanced foot. Any veterinarian can help you in a way to inject, but if you don't balance the horse's foot, you have not done any justice. So that's the key. And so when you look at this horse, same thing. So this horse was already in a wedge, okay? And this horse on the left, I personally have seen this horse multiple times. The horse has been progressively getting better in terms of its lameness grade. For me, it doesn't have enough sole depth, okay? And so when you look at sole depth, you look at the measurement from the bottom of the coffin bone to the actual level of the shoe or the ground. And so, or where the sole is. To me, that sole depth is very low on the left. And so it's very, very shallow sole depth on the left. But look at the right. So if you compare those 2 images, the right actually has pretty good sole depth, okay? About a centimeter, which is about 10 millimeters, is pretty decent sole depth. It has about 5 millimeters, maybe even 4 millimeters, I think I measured on the left. And so to increase your ability to manipulate the foot, you may need to increase sole depth. And so there are shoeing techniques for that. So I use soft rider shoes or clogs, okay? And soft riders are very good. You can actually use those, help increase your sole depth. So those shoes are made by Soft Rides. We'll talk about these later, but the soft rider shoes is what I recommend to increase your sole depth. And also you can still use the horse. You can still perform with the horse. You can still ride your horse even with those soft riders on. And so they're essentially a clog based shoe. So some horses too, in terms of giving them support and balance of their foot, I think you have to look at the overall shoeing and the overall generalized purpose of your shoe. And so this is another question that I'll have is, well, would you do open heel or closed heel? And so for me, would you do a bar shoe or would you leave it open heel? And I think that what matters is what's wrong with the horse. And I think there's proper ways of shoeing either one. And so when you take a bar shoe or an open heel shoe on horses, I think if you're able to balance the horse's hoof, I think that's great. And so for me, the other way of thinking and giving their horses better support with their either their angles or with their lameness or degeneration of their foot and problems with their feet, such as laminitis or coffin joint issues, is to help support them is shoeing with pour-in pads. And you hear this all the time. So number one, I think of pour-in pads as extra support. So thin soles may not be a bad idea to put a pour-in pad or a leather pad. It just helps them perform. Takes their sole pressure off the ground, allows them to maintain and grow hoof. And some horses are very thin soled. And so this is a part of the process in corrective shoeing and making a well-balanced hoof. And the other part of shoeing, and you can see this on some of these horses with contracted heels, is to actually, and with sheared heels, so you have a high-low situation where one side of the heel, if you look at the hoof, is longer than the other side. So you have a sheared heel effect. You actually have farriers will actually extend their bar of the shoe past the level of the heel and add support. What that does is allow their hoof to grow in a better way and actually give their heel more support and help it expand over time. And so it's going to be a process, but this is you'll see in some of these horses where this horse is imbalanced, and it's imbalanced medial to lateral based off of the contracted heels. And this is a very good way of giving their heels more support, is to extend their bars of the shoe more lateral. So then we'll dive into tendon and ligament diseases. So where you can use the foot and the manipulation of the foot to help. And so number one, I think of flexural limb deformities, okay? And so number one that crosses my mind is a club-footed horse, okay? And so club-footed horses are horses that have contracture of the deep digital flexor tendon that attaches to the coffin bone, and it's pulling the coffin bone, okay? You can see here in this 8-month-old, you can see the right front is our culprit, is our foot of interest. The actual image on your left is before doing surgery. So when you think of a check ligament, you think of two ways of helping the horse. You think of giving them toe support or trying to, rest the heels and allowing their foot to lay down naturally. And why would doing a surgery help? Well, you do a check ligament desmotomy. And so a check ligament desmotomy in these horses is sometimes a way to go in terms of surgical management, in terms of allowing this deep digital flexor tendon to have that relaxation and go to semi-normal position, okay? This is the horse before on the left-hand image, before check ligament desmotomy. This is the horse after. I need to have a proper balance of the foot. I'm not there yet. And so even while doing surgery as a surgeon, I still need to properly balance the horse's foot. And so ways of doing that is corrective shoeing. And you can see this corrective shoeing and this proper way of correctively shoeing this horse gives this horse better support. And so you have an image. These are two images of the same foot, two different ways of shoeing a club-footed horse. So you'll hear about this, but rasping the heels as low as you can, okay? And so you gradually lower the heel and you then put a toe extension on. That's the image on the right. You can see that the actual toe of the shoe has been cut away from the bars. So the bars are gone the natural way, and you can put a toe extension. However, it puts a lot of pressure on the toe of the horse's hoof, okay, at the level of the toe and along that dorsal column of that lamina. These horses can get sore pretty quick, okay? And so you want to manage that aggressively at first. And this is one way of multiple ways of correctively shoeing a club-footed horse. The other way is actually, if you look on the left, this horse is now shod in a full shoe. Okay, this is a shoe that has glued on. Okay, it's a baby foot. We actually glued on, did not use any nails. Okay, it's a glue on, but this gives better balance throughout the entire foot capsule. Okay, and so management wise, I think this, when you look at this is better eye pleasing, or appeasing, excuse me. This is better, more pleasing to the eye in terms of its angle. However, the horse got really sore with this toe extension, went ahead and placed a better balanced foot. We actually, and you can see the dead space here, we actually floated the toe. So the horse is not weight bearing anywhere on the toe. All this pressure that the horse had throughout its life before it came here to this hospital created so much pedosteitis that it created a ski tip and a malformation of the bone, that once we relieved the pressure here at the toe and we actually supported the balance of the foot, horse was jumping through the pasture. So horse was completely sound, was rearing, double barreling. It was pretty awesome. He was very, very comfortable. And so I think that's where you think about the well-balanced foot and having these issues. I think this is a very good example of, yes, there are extremes to figuring out exactly what we can do with a horse's foot, but it's not the well-balanced foot. And then use this as over time, take out more heel and naturally occur with time to get them to look this way, or to get the coffin bone to look this way. But the horse is naturally sound with a better supported hoof. Okay. This is another case. So you'll see in these yearlings and the 8 months old weanlings, you'll see this, but this is a severe flexural limb deformity of the metacarpal phalangeal joint on the left fore. And so you'll see these horses. And so number one, I think you can look and see, when I look at this foot, it is not balanced at all. So the shoe ends here. Well, really, the shoe should end at the heel, okay? And look where all the pressure is, at the toe. And so this was the thought is, okay, this is where the biomechanics and the forces applied to the foot can help with the limb and the way it actually is supported. This is a very good case. So when you look at this shoe, this is naturally forward. Well, if you think about landing, that should make the ankle or the fetlock go ahead and extend. Okay, it doesn't. It does the opposite. So when you look at the image on this is the same horse. Okay, just came in for shoeing. Look at the image on the right, and you can notice the horse is in now wedges. So when you have a fetlock abnormality and you go ahead and you properly balance the horse's foot, set the shoe back a little further, see how we took the toe off, got that elongated toe back. But if you wedge a horse, you actually bring the ankle back. It is, if you think about it, it doesn't make any sense when you think about it, when you take your own wrist and your own hand and you think about it. But biomechanically, what's going on in this horse's tendons and into this horse's hoof, it sets the ankle back. So when you have flexural deformity of the fetlock and you want to bring the horse back, and honestly, this happens with knees as well. So if you have an over at the knee horse, you actually can manipulate the horse's foot and wedge these horses to bring this ankle back. And so you into normal and almost, excuse me, normal position. Now this horse has been like this for, I think it was 6 months before presented here. So it's going to take a long time for this fetlock to regain its extension and over time. And the horse did very well. And so just with corrective shoeing, that's how we got. And so yes, there are surgeries that we can perform, and which we can, but the horse just with corrective shoeing has come that far. And so that's a dramatic difference. Okay, this is another horse. Okay, so you can tell by the picture there, this is a hind leg. So you can see the hocks, and then you can see the feathers on this horse. Very, very important horse to the owner and to us. And so you can see by the shoes, there's a toe extension. So this horse had bilateral, so left hind, right hind, flexural deformity. So contracture of both hind feet. And so the number one thing is, okay, can you perform surgery? The answer is yes. However, if you notice, the horse is a dark bay and black on its legs. And so when you perform surgery as a veterinarian and you have black legs, what is the likelihood of you're going to get white hairs? Pretty good. So, so for me, in terms of managing this, I explained everything about surgery to the owner, and the owner was like, no way. And so I get it. I mean, the white hairs are important, especially in the horse's discipline and to the owner. And so how do we manage this? Well, toe extensions. And so when you have a horse in the hind leg, right? And so you have the same flexural deformity as club-footed horses in the forelimb. Now the horse is club-footed in the hind. What do we do? Well, to be honest with you, you get more aggressive and you can do toe extensions. Okay, and then you trim the foot, you trim the heel, and over time you help with medical management on how to alleviate some of those tendons. And I think that's important. So manipulation of the horse's foot did the trick. And so this is another manipulation of the foot for upper limb issues. Okay, so this is really cool too. So the flexural limb deformities are very important on managing the horse's hoof care and the foot. However, this is perfect timing for the month, because now we're starting to get foals on the ground here shortly. So you look at the angular limb deformities. Okay, and so what I like in babies is what's called the ibex baby cuff. So babies don't do well with shoes and nails. And so these baby cuffs are very, very nice to use. So ibex baby cuffs, they're called. They can buy them online. And so what you can do is actually cut areas. So the cuff comes in sections, and there's stages to these cuffs that are plastic, and you can actually cut the area that you don't want to extend out. So when you have an angular limb deformity or a flexural deformity, like this horse in this image on the right, you can actually cut away. So this horse still has the cuffs. This is just an example. These areas of the cuff, you can cut away those and just use the palmar or plantar extension. In this horse, it was a palmar extension of the front leg. And so you can use that extension of that cuff to help support the fetlock, okay, and help support the upper limb. When you have an angular limb deformity, you can actually use the extension on these cuffs as your tool to help manipulate the growth plate of these horses and grow properly and to grow straighter limbs. Because when an angular limb, imagine an angled diagonal leg, that's not good for performance as well as the horse's comfort. And so you can manipulate these areas with just shoeing and just proper hoof management. And so that's important. So this is another area. Okay, and so the ultimate is suspensory ligament. lesions. You don't want to hear that as a horse owner, and you want to think about something else. But I've been there. I've had it myself with my own horse. And so how can you provide support to their limb with shoeing? And you think about a suspensory, well, that's up on top of the leg. I mean, that's where the flexor tendons are. That's not anywhere near the horse's hoof. Well, yes. However, you can manipulate the hoof to actually alleviate the pressure on the suspensory ligament. And so this is very important because I think this is where you can look at the biomechanics of the foot, and we'll go into that again, is you can help the horse overall as a veterinarian and as an owner with, biologics, so treatment of that lesion in the suspensory. But unfortunately, without proper foot care, I think your horse is more likely to re-injure and also have a prolonged outcome of or progress of healing. Because when you think about this, when you don't manipulate the horse's hoof and you allow them to either be underrun or have foot issues going on as well as your suspensory issues, that's where I think you don't have the proper management in terms of the balance of the foot. And so you have to look at the entire leg as a unit. And so when you do that, this is a lesion where you can use what's called the Denois suspensory shoe, which is an image here on in the middle of your screen. That is the actual forging, and you can buy that shoe online. The other way of doing it is actually forging your own. And so I have farriers will forge this. Same premise would be to make a toe plate, okay? And then extend the bars of the shoe about a 1/4 inch past the heels, okay? Well, the diagram there on the right shows the premise of why the shoe works. So in deep sand or in arenas, or if you have a deeply bedded stall, the shoe toe plate manipulates the toe to stand on top of the actual ground surface. Then when you have the heels sink because of the lack of the toe plate and the extended bars and the narrowing of the bars of the shoe, that heel sinks in the ground, and then that actually pushes the fetlock up, and it gives pressure off of your suspensory ligament. So the fibers that are torn in your upper limb are now able to be less strained. So you're under tension all the time. Well, when you put the shoe on, you alleviate the tensile forces and you allow those fibers to reunite. And I think that's where you have a faster recovery, because you're able to get those fibers to relax. It's like us having our leg in a sling or our arm in a sling. When you hurt your shoulder, you can relax your arm and allow your shoulder to heal. Well, the same premise, you can use the horse's hoof to relax the suspensory ligament to help them heal. Okay, and so the left image, I just called it a replica, but essentially it's a welded toe plate onto a shoe, helps alleviate the pressure on that suspensory. Okay, or you can buy a Denois suspensory shoe online and put that on. Okay. All right, so the other technique, so this is important when you're thinking about sole depth, and so this is where it ties into that portion of the lecture. So shoeing techniques to grow and to support the entire hoof capsule. And so the image on the left is the chronic laminitis horse. The image in the middle is actually a keratoma out of a draft horse. And so then you have a 2,500 pound draft horse that needs to have its foot supported. And so those are very important things. And so knowing that you have to resect all that hoof wall, you have to have a well-balanced hoof. And so that's another area to think about, and these are the shoeing techniques. And so then you think about the sole depth and looking at the image on the right as very little sole depth. And so how do you promote or how do you promote sole depth growth and support of the shoe or the foot, excuse me, is a shoe. I use clogs. So clogs, I think are very adaptable. So these are actually made out of plywood, and you attach the horse's hoof to clogs, which are plywood based, grounded out shoes. And so that gives support to the whole hoof capsule and alleviates the pressure at the toe. You can see this horse has laminitis. You can see that the actual hoof itself was dremeled out, where the actual pressure is relieved off the toe of the foot, and that puts pressure along the bars and the quarters of the foot, and allows that that horse with laminitis to heal. Okay, and the other way of growing a better hoof is with soft rider shoes. And so this, you can see there, the image on the right is actual soft rider shoes. Soft rides are another option as well that you can see on this image from softrideBoots.com. They have a plethora of boots as well as shoes. I like both, and both are able to grow enough sole support and help support that whole capsule. So, you know, in the end here, we're going to review the biggest points I have are, you know, the hoof is a vital part of the horse's performance. And so when you talk about performance, you want a horse that's naturally going around comfortably. You want a natural gait of the horse, and the horse to be sound. And so I think, you know, hoof nutrition, and then also having a relationship with your farrier, your owner, you know, knowing what they would like, and or the owner of the horse, what they need to provide the horse with, is key to horse's success. And so I know it was a little bit, but I would like to thank Miss Ashley Best for all of, you know, for allowing me to give this presentation, and I'll take any questions.
Absolutely. Thank you for being here for sure. And if anybody has any questions, you know, don't hesitate to unmute yourself. Feel free to ask. This is kind of like an open forum here with Dr. Younkin. You have his undivided attention. He's a hard man to get on the books with. So now is your chance to ask those questions. And if you don't want to unmute, just type it in the chat box and I will read it. So this topic was kind of interesting to me because I had some hoof questions, and I had some issues with my horse and keeping shoes on him. So, you know, we took the x-rays, and really ever since we took the x-rays and I showed them to my farrier and I've been talking with him, my horse has done really well. Like, he's kept his shoes on the whole cycle. He has, you know, he's been performing better. So definitely getting those x-rays is key to, you know, having your farrier implement that well-balanced hoof.
Yeah, no, that's a great point. I'm glad he's doing better.
Yeah, absolutely. Well, if there are, Scott says, what's your opinion and success with external hoof treatments like Hoof Doctor for preventing disease and building a stronger, healthier hoof? Yep.
So yeah, good question. So I think what my experience is, I think it does work for some horses. So I have two examples of that in terms of its, I think it's important. I think I had to double the dose of Hoof Doctor to finally get a better hoof quality on the brittle hoof. I think it was a horse that had a brittle hoof, and overall just really dry, and it was cracking. I think they had dorsal hoof wall cracks. And so yes, I like it. I've used it. That horse has done well, but I had to double the dose.
Another question is, does a horse need shoes if it's just a pasture horse?
So if it has proper balance, my answer is no. So you don't need, so yes. So I think even a performance horse, even if it's a pasture or performance, I think if you have a well-balanced hoof and you're able to maintain the hoof care, you may not need shoes on a horse.
Yeah, I have a mare that has great feet and she does not have shoes on and she's a performance horse. But then I have the gelding that's, a wuss and he needs shoes. So in performance. So I'm actually gonna pull his shoes this winter and we'll see how he does without shoes because we've finally got his balance right.
That's good.
All right. Any other questions before we log off and say goodnight? Okay. Ed says, I have a front hoof with a superficial crack straight up the center of the toe. When shoeing, the crack does not go all the way through the wall, but it will start to grow down. So would that be like a quarter crack maybe, or?
Yeah, so you can, it would be a dorsal hoof wall crack. And it's right in the center. I would go ahead and Dremel it out. I know it's not, so the horse must not be lame, but it's just a bother. So I would Dremel that out, get all the moisture out of it, and then I would lace it. If it goes higher, number one, I'd X-ray, take a lateral view. You can do a lateral view, see if there's any gas pockets proximally to that crack. If there's not, then Dremel it out, put those laces in, or even Dremel it out and leave it dry. Those horses do pretty well as long as it doesn't go up to the cornet band or anywhere close.
He says it does. He says sometimes it then goes back up to the cornet band.
Yeah, so I went ahead and unmuted just because this is going to be easier.
Okay. Thank you for.
I've changed different. I've used different feed through supplements to try to strengthen the hooves a little bit, and it'll start showing growth from the coronary band, and it'll come down a little ways. And I've changed a couple of different times. Right now I'm using Source, but it started growing down, and then it'd get about maybe a quarter of an inch, like, okay, I got good hoof coming down now, and then it would just go right back up to the coronary band again. And then it'll almost be like there's a crack across, a straight line across even direction of the coronary band, but it's not very far. It's just a little bit on either side of the center line crack, and then it'll start growing back down again, and then it goes right back again.
Yes, sir. Yeah, so definitely I think either you have an anitis, so infection, or could you have a keratoma? The other question is, all right, so I didn't touch on keratomas today, but I should have. Well, I did on that draft horse. So keratomas can create a crack that never goes away. And so what I would do is start dremeling out that crack and follow that black line. You'll see black debris coming away from that crack. Follow that down until where you have nice junction between your white line, and you'll get a solid junction. But if it's not solid, cut it out. And so I've had horses that have moisture that, the crack grows a little bit and grows down, and then all of a sudden reforms because of moisture. And so it's just like, I guess like cement. So if water goes underneath the cement, and it cools hot, the cement cracks. And so the same thing happens with the horse's hoof. And I think that's important. I think we should investigate either X-ray, take one lateral view, or have, start and Dremel that out and see if you can follow a black line all the way up. If it looks pretty good, then X-ray and see if you have a keratoma.
Well, like I say, when you shoe him, when you trim off all of your flares and everything, and
yes, sir,
level everything down, the crack goes away down at the bottom.
Okay.
You don't see it at the bottom. It'll, you just got good solid hoof there at the bottom, but it's running straight up and continues to just, the top of it won't ever go away.
So then my answer is start at the top. It'll always grow down. So start at the top, Dremel down, and then lace it. The other question is then, all right, shear forces. Are your shear forces creating your crack to propagate proximally? And even with a shoe on, typically you don't think of that because you have a better balance of that dorsal hoof wall. But then is there anitis? And so if the shoe's on and the crack still propagates proximally, then I would think of either still infection in there or keratoma. I would. And I would investigate that, Dremel the heck. So I would Dremel all of that out, you know, and as wide as you can get it, and go as close to the cornet band. And sometimes I get them where they're at the cornet, and then you Dremel all that off, and then over time it will grow down. But if you don't relieve all the nidus, it's just going to come back and fester.
Okay, I got you.
So one more
Thank you very
question.
much.
You're
Danielle
welcome.
says, how long does a good hoof supplement need to be given before you'll notice an improvement in hoof quality for shoeing?
Yes, I think 60 days. 60 days is a good understanding whether the hoof supplement's going to work. I think 2 months, 60 days. You can say 30 days, but I think that's a little bit over, you know, I think that's too soon. I think you need a full 60 days to say, okay, I'm either not seeing a difference or yeah, I'm seeing a difference. And really, if you think about it, that's about 2 shoeing cycles.
Yep, perfect. And Christy was bragging on you. She said, Dr. Younkin has made a world of difference for my horse. What we thought was the issue was actually a secondary to the real problem. And we changed his shoes and are keeping him balanced. He's a new horse.
Thank you. Thanks.
So, well, thank you, Dr. Younkin. And if anybody thinks of questions after the fact, don't hesitate to email me.
Yeah.
And we will say goodnight to everyone. And thanks again. All right.